Hi, my name is Taylor Boudreau. I'm in the Family Nurse Practitioner program at Auburn University, and I'm here to talk to you today about laceration repairs involving simple interrupted sutures. So to begin, I have my suture pad, I have my needle drivers loaded with a suture, I have some tweezers, and I have my scissors. I'd like to point out that in a real patient clinical setting, I would make sure my environment was sterile. I would have sterilized equipment, I would be wearing sterile gloves, and I would obviously be using all standard precautions. Also, if I had a patient coming in with a laceration that required a repair, I would make sure I did a thorough assessment of the wound, noting its location, its depth. I would make sure I would assess neurovascular status, so sensation, cap refill, making sure it has adequate blood flow, and obviously making certain that I wouldn't be doing more harm than good by suturing their laceration. There are certain lacerations or injuries that would present that you would want to refer out to either the ER or a general surgeon. And those would include injuries to the face or surrounding the eyes or the eyelid, the mouth or the inside of the mouth at the lip. You would want to make sure if it were like an abdominal laceration that it weren't penetrating. You would worry about obviously things getting into the abdominal cavity, and you would want to worry about any kind of puncturing or penetrating wound there. When it comes to assessing a wound for suture repair, you would want to know if it had any type of debris left in the wound. So depending on the mechanism of injury, you would want to make sure you're not leaving any type of debris or foreign body in the wound. And to do so, you would want to make sure you thoroughly inspect it and do a thorough irrigation. You can do that with sterile water or saline, and that would just help ensure that you're not closing up the wound with anything left in there that could lead to further infection or irritation, and also just making sure the wound is clean before you close it. Second of all, we can talk about the different sizes of sutures depending on the location of injury. So if it is a facial laceration, you would want to use a 5/0/6/0 suture. Depending, if it's on the trunk of the body or the abdomen, you would want to use a 4/0, 3/0, or 4/0. And if it is on the arms, legs, or extremities, like your hands or your feet, you would want to use a 4/0 or 5/0. So to get started, you would want to make sure that the patient has been thoroughly cleaned, the wound area has been cleaned and irrigated. You would want to make sure that they are numb. So suturing can be uncomfortable as you are closing the wound. So you would want to use a local anesthetic. If it were something like the hand or the fingers, you might opt to do a digital block, obviously keeping in mind that when you're using any type of numbing solution, you would want to avoid using epinephrine when it's a laceration of the extremity, because that could impede the blood flow and you could have further injury by adding epinephrine. So you would want to use like a 1% lidocaine, and you could do a digital block if it's in the hands or the fingers. You would want to use a sub-Q needle. You would go in, inject the sub-Q needle with the 1% lidocaine, and as you're drawing the needle out, you would kind of go around the entire perimeter of the wound. So if it, say this is your wound here, you would inject the needle here, and as you're drawing out, you would inject as you're pulling the needle out. You would go in the same way, put your needle in this way, and inject as you're drawing out, same here, and this is called a field block. So ensuring that all sides of the wound are properly anesthetized. And before you begin, obviously you would want to do some sensation checks. You could do, you could take your tweezers and you could poke and say, do you feel that? They may feel pressure, and that's okay. You just don't want them to have any sense of discomfort. So what we will do, I'm going to take my needle drivers with my loaded suture, and I'm going to take my tweezers in the other hand, and we're gonna do what's our first incision. I'm holding the suture at the very back third with my needle drivers because I'm going in at a 90-degree angle. I wanna have more control. So with my tweezers, I'm going to pull the, can you see? Okay. I'm gonna pull the skin over, and we're gonna go in at a 90-degree angle. Coming out the other side, I'm gonna grab the other end of the suture needle, and we're gonna pull through until we have about an inch to an inch and a half remaining suture on the opposite side of the wound. So the first knot that we're gonna make is called an instrument knot or a surgeon's knot. So I'm gonna take the suture string with the suture needle on my left side. My my needle drivers are in my right. So I'm going to wrap my suture around twice, and then I'm gonna go grab the remaining tail here and pull. So we would want to make sure as we pull that first knot down that the wound edges are approximated without being too tight so that the skin is pursing or puckering in the middle, because you don't want too much tension as that can cause more damage. So now that we have our first instrument knot down, we're going to do the same thing, wrapping it around once and grabbing the end and pulling tight, and then wrapping over and grabbing the end and pulling tight, under one more time and pulling tight, and then over one more time. So you'd want to do about 4 or 5 passes to help ensure that the knot will not come undone. And then once you have your suture secure, you can trim it. So you want to leave a good little tail there. And we will go in for our second stitch. So again, in a real life setting, I would not be handling the needle as it would be contaminated, but my tweezers make it very difficult to do so. So I've loaded my needle drivers. We're gonna take our tweezers, grab the opposite end of the wound. We're gonna go in about a few millimeters down, and of course that could change depending on the wound. You just kind of have to take it case by case. We're gonna go in on the right side of the wound, my right side, at a 90-degree angle, gliding the suture needle through. And once it has broken through to the other side, we're gonna grab it with our needle drivers and pull. Again, leaving about an inch to an inch and a half tail. So here we go with the surgeon's knots. We're gonna wrap 1, 2, and grab the tail and pull. Then we're gonna go over and grab, under and grab, over and grab, and that should be good. And we will trim the ends once we're happy. Okay, so that is my second suture. So again, we will load the needle driver with our suture needle. Okay. Using our tweezers again to approximate the edges of the wound, we are going to go in on the right side of the wound at a 90-degree angle, coming across to the opposite side with our suture needle, grabbing the suture needle and pulling until we have approximately 1 inch on the other side. So we're going to do our instrument tie, 1, 2. Okay, we're going to go over, under, over, under. Okay, once we're happy with our third suture, we're gonna go trim the tail. You have 2 more to go. Something important to note, I'm repeating the process and I'm going to talk as I do so. Something important to note about care after suturing of a laceration would be you would want to educate the patient to keep the wound dry and clean. If they choose to do so, or you're worried about infection, you could advise them to use something like a topical Bactroban or mupirocin cream and apply a thin layer over the sutures every day. You would want to educate for signs of infection like redness, heat, swelling, purulent drainage, and advise them when to come back. Typically, for sutures of the face, you would want to have them come back in about 3 to 5 days. Sutures of the trunk would be about 5 to 7 or 5 to 10 days, and then sutures of the extremities would be about 7 to 10 or 7 to 14 days. So we're going to do one more tie here, and we're going to trim the tail. One reason you don't want to trim your tail too short is because when they come back in a couple of days, depending on where their laceration repair was performed, you want to be able to easily see the knot that you have tied so that you know where to cut, so that you can cut once, pull it by the knot, and take it out. So going in on our last suture here, I'm going to go in at a 90-degree angle, going across the wound bed, grabbing our suture from the other side and leaving approximately 1 inch to 1.5 inch tail. Going in on our instrument tie, we'll do 1, 2 around our needle drivers and pull. Over 1, under 1, over 1, and under. Making sure that the knot is secure before we trim it, and then making our last trim of the remaining suture. So this is my set of 5 interrupted simple sutures with my wound bed approximated. Again, I would educate the patient to keep it clean and dry, avoid swimming or anything that could further contaminate it. We would want to keep it covered with a layer of either mupirocin or Bactroban, or even Vaseline, just to kind of keep that skin clean and help deter bacteria from entering around the suture site. So I hope that was informative, and thank you so much.